The modern healthcare system is increasingly reliant on imaging technology to make fast, accurate diagnoses, and among these tools, CT scans, computed tomography, are one of the most heavily used. These scans can be invaluable in emergency situations or when serious conditions like blood clots, tumors, or internal injuries are suspected. But a new and deeply concerning study out of the University of California, San Francisco raises a red flag that cannot be ignored. These very scans, often used under the banner of life-saving care, may quietly be contributing to a growing number of cancer cases across the United States. The estimate is chilling. Researchers project that over 103,000 future cancers, amounting to 5% of all cancer diagnoses in a single year, could be attributed to the ionizing radiation from CT scans performed in 2023 alone. That figure is not an abstract speculation. It's rooted in updated analysis of national imaging volumes, scan types, and radiation dosage data. And while it is based on statistical modeling, this is the same kind of evidence that has shaped public health guidelines for decades. We didn't need to observe every smoker develop lung cancer to take action against tobacco. We shouldn't need to watch tens of thousands of patients develop radiation-linked cancers before we confront the scale of this problem. The issue lies not in existence of CT technology, but in its overuse and misuse. Many of these scans are deemed medically unnecessary, what the research refers to as low-value imaging. In other words, doctors are often ordering scans that provide no added benefit to diagnosis or treatment. And yet, each scan exposes patients to significant doses of ionizing radiation, a known carcinogen. The troubling reality is that we've allowed a culture of casual scanning to take root, and that culture is now bearing a toxic fruit. What makes this even more dangerous is how few patients are aware of the risks. People tend to think of CT scans as completely benign, just another box to check in the diagnostic process. But the radiation from a single scan can range from the equivalent of several hundred dental X-rays to more than 8,000. This exposure accumulates over time, especially for patients with chronic conditions who undergo repeat imaging. And while the overall lifetime cancer risk per scan may seem small, those risks multiply rapidly when millions of scans are done annually, particularly among vulnerable populations like children and infants. Babies under 1 year old, for example, are 10 times more likely to develop cancer from CT radiation exposure compared to adults. Worse still, there's a glaring lack of standardization in how these scans are administered. The dose of radiation a patient receives can vary enormously depending on the facility, the operator, and the equipment used. Two patients getting the exact same scan might receive completely different radiation levels, and this inconsistency is largely invisible to both patients and doctors. No federal standards exist to regulate the dosage of radiation in CT imaging, which leaves the healthcare system flying blind and patients exposed without informed consent. Incredibly, it is still the patient's responsibility to ask for a lower dose scan or to question the necessity of a test. That's not just irresponsible, it's unethical. No one should have to advocate for their own safety against the silent risk of radiation-induced cancer. Yet the system offers little in the way of transparency. If a doctor told you that a routine scan could increase your cancer risk by a measurable amount, especially when other safer imaging options like MRI or ultrasound are available, you might think twice before agreeing. But that conversation rarely happens, and many clinicians themselves may not be fully trained to navigate the risk-benefit analysis in every case. And while some industry voices have pointed out that the study's numbers are based on projections rather than direct patient outcomes, that argument falls flat. Modeling is the basis for much of what we accept as medical science, from the benefits of vaccines to the dangers of asbestos. If anything, some experts suggest that these cancer estimates may be understated. The study didn't even include radiation exposure from image-guided procedures, standard X-rays, or repeated imaging over time. The cumulative toll of these interventions, especially on younger generations increasingly exposed to medical radiation, may not be known for years. We are witnessing a preventable crisis in slow motion. While CT scans undoubtedly save lives when used correctly, their routine overuse is creating a silent but potent public health hazard. It's easy to focus on the life saved today and ignore the life potentially lost 5, 10, or 15 years down the line due to unnecessary radiation. This short-sightedness must be replaced by a culture of caution and critical thinking. Medical institutions need to overhaul their imaging protocols, reduce radiation doses to the lowest effective levels, and make informed consent mandatory before every scan. The federal government must act to implement radiation dose standards and require full disclosure to patients. Physicians must become more discriminating in their use of diagnostic imaging, and patients must be educated to ask the right questions, not out of fear, but out of self-preservation. Let us be clear, CT scans are not evil. They are powerful tools in the right hands and under the right circumstances. But their widespread and largely unregulated use is setting the stage for a long-term increase in radiation-related cancers. We cannot afford to keep looking the other way. The time to act is not after the diagnoses come in, but now, before the harm becomes irreversible. Until CT scan use is driven by necessity, rather than convenience or habit, we are trading short-term reassurance for long-term risk. And that's a trade-off no one should have to make.